There are lots of anecdotal reports in the literature of other means of recovering your sense of smell. There are actually several documented studies from China that show that acupuncture can be used to recover the sense of smell. We don't have a mechanism for that, but there are data there that are inviting and perhaps of further research. But, you know, the question is there something that, apart from me as a physician, that I can prescribe? Is there something that an individual that's lost their sense of smell can do? Beverly, what is the latest on that?
So the kind of big new thing is olfactory training. Olfaction is, in many ways, as said, a learned sense. And olfactory exposure and training have been shown to improve olfactory discrimination and sensitivity in both human and animal models. Only recently has this idea been applied to the potential for helping patients who've lost their sense of smell. And there have been 4 or 5 studies at this point that have shown that at least some patients with olfactory losses that are in those studies, they were either due to URI, head injury, or Parkinson's, can benefit from twice-daily exposure to 4 odors. The 4 odors that have always been used were quite frankly rather arbitrarily chosen. But there are rose odor, eucalyptus, lemon, and clove. But as I said, not everybody seems to benefit from this. Maybe 30% of the patients seem to show improvement. And there are a lot of things we don't know about it. What types of patients are the most likely to benefit? Can the effect possibly be enhanced by using different odors or more odors, or by adding a cognitive component? These patients are just told to sniff these things twice a day. Maybe if they had a game to play with them, if they had to discriminate them, if they had to label them. There is some evidence that enhances the training effect, at least in normal subjects. And finally, we have no idea how long-lived the effect is, whether this is something people have to do for the rest of their lives or for what period of time they need to do it. On the other hand, it's a simple enough thing to do and doesn't have any adverse effects, and so I think it's a reasonable thing to suggest to patients.
Yeah, I've suggested it to a number of patients, and they look at me and they say basically, "Are you serious? I can't smell anything. What am I smelling?" And so it does require a little bit of faith, and most of the patients, however, are frustrated, really, really frustrated by their loss of sense of smell, and they're very willing to do this. So I would encourage you to tell the patients to do exactly that. The odors that are in the literature are the ones that Beverly has described. I will say that the odors that I typically suggest are a little bit different. I usually ask them to use a scented or flower or cologne that they are commonly used to smelling, because I think that if you're used to the smell, then perhaps there is an inherent processing that can be reawakened. I say coffee, and the reason I use coffee grounds is because they're easy, and coffee is generally a pure odorant, one that you can use to actually test somebody's sense of smell. Citrus smell, as suggested there, because those are usually easy as well. Orange peel, or you can get orange peel itself in a container in McCormick Spices, and cloves, which are easy to get in McCormick Spices as well. And if you have those set out, then the patients literally will spend 20 seconds or so smelling each one of those twice a day. And I will say that at first I was very skeptical when I read this research, but it does 2 things. One, it actually works in 30% of the patients, which is very important. But 2, it gives the patient a sense of mastery over the condition. And that is extraordinarily important, because they really are very frustrated that there is nothing that they can do. And so finally you're saying, yes, there is something that we can do.